Hello, my name is Amy Mansue, and I'm the President and CEO of the Inspira Health System. I want to thank you so much for being with us today for our annual meeting. A little housekeeping, if you don't mind. For those on the webinar, you may know this already, but we cannot see or hear you. Questions on the screen you'll see will be a box labeled Q&A for questions and answers. Feel free to submit your questions throughout the presentation, and we will address as many as possible at the end. Your questions will only be visible to our panelists. If you'd like to keep your identity anonymous, please check the box that says anonymous before submitting your questions. The objective today is that New Jersey law requires that every hospital conduct an annual public meeting organized to provide the community served by the hospital with information about the operations of the hospital and provide an opportunity for the public to ask questions and raise any issues. Today, we are going to provide the growth updates for Inspira Medical Center Vineland, Inspira Medical Center Mullica Hill, and Inspira Medical Center Elmer. And then concluding after those three presentations, we'll give you a network update, which will talk about the awards, the partnerships, our community impact, and go through our financial results. Our mission is to provide a safe and compassionate experience that improves the health and well-being of our community by placing the safety of our patients and the support of our employees at the center of all we do. And our vision is that Inspira Health inspires and empowers healthier communities by creating the highest quality and the most desirable patient experience in the region. And this all is accomplished through our values. I create. I stands for innovation, C stands for compassion, R for reliability, E for empathy, A for access, T for teamwork, and E for an empowerment. And we live those out by each of the comments that you see below on the screen. Inspira Medical Center Vineland. First, I'd like to start with our quality awards. We're very proud that all three of our hospitals have achieved Leapfrog A. Leapfrog is a national quality organization that reviews, that is a voluntary submission to review hospitals. They give letter scores, and an A is the highest score you can achieve. The Beacon Award for Excellence was achieved, Excellence in Critical Care Nursing was achieved by our Cardiac Intensive Care Unit and our Progressive Care Unit. And lastly, we have received a accreditation as a National Center of Excellence for our Bariatric Surgery Program. That is our newest award on this list. I'd like to begin by talking about one of our newest additions, our endoscopy center at Vineland. I'm very proud to tell you that this was opened in June of 2022. We had already done 3,700 procedures from June to June, and we have now exceeded 4,000 procedures. We know GI is a very important service that is needed in our community, and it showed up on our community health needs assessment as one of those areas of access that needed to be improved. PCI, this is better known as elective cardiac cath. We began offering that in June of 22 after the law changed that would permit us to do so. This allows us to care for more cardiac patients in our community closer to home. And indeed, we did 22 patients, elective PCIs in 86 in 2022, and we did 100 more in 2023 as of June 23. As we stand here today, we've already surpassed 200 PCIs being done. Again, this is critically important because before our community members would have to go to Camden in order to achieve this procedure. Our maternal health pilot. New Jersey has the 5th highest maternal mortality rate in the country, and the mortality rate in South Jersey is even higher than the states. These statistics, however, require some consideration. There is a very small sample size that we pick from, and also within that sample size has a higher utilization of opioid overdose deaths in South Jersey. From 2016 to 2018 in New Jersey, 125 women died in pregnancy-associated causes. 46 of those deaths were in the state's 7 southern counties. Most of these deaths occurred between 42 and 365 days after delivery, And the leading cause of those deaths was substance use disorder, and the cardiac cases represented 18%. As we look for solutions, we must look beyond the hospital walls and make sure that we again address the appropriate supports for individuals in need in our community. We have begun a pilot program with the Camden Coalition and with our federally qualified health center in our community, Complete Care. Our goals of that pilot project is to address the barriers for receiving prenatal care and also ensuring that we've identified needs for transportation as well as child care. The support of the mom is most critical as we continue to move forward, and those discussions and those plans will continue to move forward in earnest. We understand our responsibility to partner with our community partners within the nonprofit community, as well as with the prosecutor's office and the local sheriffs, as well, and our police chiefs, and we all have taken this issue of opioid addiction very, very seriously, and you'll hear more about that as I proceed. As part of this work, we also talk about our patients and the stories that come out of here, and so today I'd like to talk to you about Dan Baer. Dan was a 56-year-old retired police captain when he experienced a radiating discomfort across his chest. His first responder training, along with his knowledge of his family history, told him he needed to act fast, and he immediately went to the emergency department at Vineland. He had a heart attack during the triage, and the ED team performed CPR and used a defibrillator to revive him. He had a stent placed in his heart and was transferred to our cardiac unit. Dan has gone through cardiac rehabilitation at Inspira Vineland, a service of both Cooper and Inspira Cardiac Care and other therapies at Inspira Elmer. He lives a much healthier lifestyle, as well as the fact that he is sleeping more. He has had a full recovery. I will now share the highlights of Inspira Mullica Hill. Inspira Mullica Hill has also achieved a Leapfrog A, as I indicated. In addition, they've achieved the American Heart Association Get With The Guidelines, the gold level for resuscitation, and ensuring that we have all the up-to-date procedures and trainings of all of our staff. We also received from Health Grades the Coronary Intervention Excellence Award, and Mullica Hill also achieved for the first time the certification as a Center of Excellence in Bariatric Surgery. Mullica Hill began performing elective PCI, elective cardiac cath, in December of 2021, right after the law was passed. They had done 201 total elective PCIs, and in 2023, they performed 122 as of June 23. Again, these are all individuals that would have been transferred to Camden in order to achieve those services at our partner Cooper, and we are so very fortunate that we can provide these services close to home and be able to stay connected to their families. Today's patient story in reference to our Mullica Hill campus is Missy Cosgrove. Missy was getting her annual mammogram, and after COVID, obviously, she had been delayed. In 2021, she received the news after her mammogram that she had breast cancer. With the family and friends all surrounded around her, she had looked at many locations in order to determine where to receive her care. And she came home to Mullica Hill to receive her care here. She lives in Mullica Hill, and while she took consult from all over the country, she knew that being close to home and having the support of the family was at the center of what she did. I'm very proud to tell you that she is in remission, and her story has provided much hope to others as she continues to volunteer with Gilda's Club, as well as in the community, sharing her story and providing supports. What Missy said always is that she was so thrilled to have these services close to home and was so grateful of how she was treated by not just her doctors, but the nurses, the registration staff, by everybody who wrapped themselves around her. Now I'd like to give you some highlights from Inspira Elmer. Inspira Elmer was also a Leapfrog hospital, received a Leapfrog A. In addition, they have received the best hospitals in orthopedics, as well as the best hospitals achievement in obstetrics as well. This is a goal that they have achieved and a success they've achieved over many years. They also were acknowledged by Money Magazine as the best hospital for maternity care, and they were actually the first hospital in the state to be identified as a baby-friendly hospital. In addition, they have received an Outstanding Patient Experience Award from the organization Health Grades. We have done expansion at Elmer of our hyperbaric oxygen therapy program. This program helps heal chronic wounds and other conditions, and it has been a tremendous asset for our communities. Patients are able to relax in the chambers with 100% pure oxygen, and it promotes the natural ability of the body to be able to heal and dramatically speeds up the healing process of our wounds. I'd like to share a story about John D'Addario. John is the deputy mayor of Upper Deerfield and is a type 2 diabetic. He said that he used to suffer from what's called white coat syndrome. He avoided doctors like the plague. In December of 22, he started to experience what he thought were symptoms of a virus. When his son Kyle and daughter-in-law Emily came over to see him, they were concerned enough and they took him immediately to the emergency department at Elmer. It turns out John was severely dehydrated and experiencing a diabetic shock, which we call DKA, a serious complication of diabetes that can quickly become life-threatening. He was admitted to the ICU unit. Over the next few days, he was treated and recovered in Inspira Elmer. He said while this scary experience happened, he was so grateful for the dedication of his care team to help him make a decision to take the control over his health care. By the time he was discharged, he had a whole new outlook. He was back on his medication, living a healthy lifestyle, and John has lost over 70 pounds, and his blood glucose numbers have returned to an acceptable level. What John's quote was what they did for me was life-changing. I feel 15 years younger than I did just a few months ago, and I tell my buddies, if I can do it, they can do it too. I know it's up to me, but the people in Inspira got me started. They gave me the confidence that I can do it. All of these stories are examples of how Inspira tries to ensure that not only do we provide care for you, but we try to inspire you to live a healthier lifestyle, understanding that requires partnership, time, and effort on everyone's part. Now I'd like to share with you some network updates. This shows you these things are apply across the board for the entire health system and shows the work that we've done on integration. I'm very proud to tell you for the second year in a row, we have achieved by both the Philadelphia Inquirer and NewJersey.com, we've been listed as a top workplace. This is based upon our employees survey, that our employees are anonymously selected and they complete that survey. I'm glad to tell you that we have additionally made continued progress in our new graduate medical education programs. We are now one of the largest community-based residency programs in New Jersey. We are currently training 256 medical residents and 10 fellows in 15 nationally designated programs. We have graduated 77 residents in July, and approximately 10 of them are staying in the area to work with us. The reason we began this residency and the board invested in it so many years ago was because we already know that many of our physicians are at retirement age or will be within the next 5 years, and that we want to make sure that we create the opportunity for young residents to fall in love with us and stay and serve our community. Most importantly, knowing the tremendous behavioral health needs and needs of our community, we are glad that we were able to welcome our first three psychiatry residents last year. And in July of this year, we recognized our 3 physical medicine and rehab residents, which is one of only 5 programs in the Delaware Valley region. Next, I'd like to share information about our partnerships. We have many partnerships within the Inspira family, within education, employment, as well as patient care. Our goal in these partnerships is to provide clinical experience that is closer to home and provide the opportunity to have that seamless transfer of our service. Our first partnership I'd like to talk to you about is the Rowan College of South Jersey. The Rowan College of South Jersey and Inspira entered into a partnership to allow for a reduction in tuition of 50% for all Inspira employees. This provides the opportunity for our individual employees to be able to either gain more skills or finish a degree that they started. This has been a tremendous success at Inspira, and we've had over 300 people enroll in the program so far and continue their education, or begin in some cases. Most recently, we have entered into a relationship with AMI, Atlantic Medical Imaging, and Inspira Health. This provides the opportunity for AMI to bring their expertise to our imaging centers in an outpatient basis. That went into effect in July, and we are very proud and excited about the work that we'll be doing. This is a joint venture opportunity, so Inspira and AMI will be continuing to grow and work on our footprint to be able to better serve our community. We understand there is a tremendous need post-COVID for the basic services, for making sure we get women in for mammograms, to do all of those things that we all put off. And so I'm very proud to have entered into this relationship and look very much forward to moving forward in that. And most recently, within the last week, you heard publicly that we announced our partnership with Cooper Inspira Neuroscience Program. We're very excited, again, to bring these services closer to home and provide that seamless transfer for those who are in need of either neurology or neuroscience services. I was thrilled to meet the new neurosurgeon last Friday when I was in Mullica Hill, and we had the opportunity to already have our Cooper neurosurgeons down in Vineland. So both at Vineland and Mullica Hill, these services will be offered. I do want to share with you that part of the collaborative work that we've done with Rowan College of South Jersey is that not only do we have this tuition program, but Rowan College of South Jersey has helped us identify how we can train individuals who we know we have a need for in reference to their skills, but there are no existing programs. This actually came out of information from our employees, where they said that they were very concerned that they didn't see that next generation of respiratory therapists coming into the field. And so again, Rowan College of South Jersey and Rowan University stepped up and partnered with us. And I'm thrilled to tell you that we will kick off a new respiratory therapy program that will begin in September of this year. And I have just a wonderful story about one of our employees, Christy Hughes. Christy is a administrative assistant in our cardiac rehabilitation area in Vineland. So she gets to see firsthand how people go through cardiac rehab, how they've lived after the procedures, and how they actually help themselves. Christy watches that program and watches the partnership with both the physicians as well as the respiratory therapists, and she's become passionate about that. And Christy is one of the 10 people, or one of the people that will begin her program in September to become a respiratory therapist. And that's what it's all about. It's providing opportunities for people to see beyond what they thought they were capable of. And this is one of the tenets of what Inspira does. We inspire and empower both our employees and our community to be better. We are continuing to expand services throughout our region, both in all sorts of areas, and I'm going to speak just a little bit about each one. In our behavioral health area, as many of you know, one of the huge impacts of COVID was a tremendous expansion of the need for behavioral health services. Our outpatient visits tripled from 2019 to 2022, and we have found our ways to make sure that we've continued to expand those services. We've added additional 19 beds dedicated to behavioral health services, and we are now expanding our Woodbury footprint, rebuilding that, and we'll be ready in late 2024, where we'll be opening our new satellite emergency department as well as our behavioral health program there. We continue to look for opportunities to create new programs, and this is we have also expanded our services within our Woodbury Center to be able to provide autism diagnostic services. This, again, is one of those stories about how our employees step up to assist the community. We had 2 employees who had already been trained as being able to diagnose autism for our children. And we heard from families that they did not have people that could provide this service for them, easily for them to access. We also saw children who were diagnosed and put in our behavioral health program, who indeed had underlying autism, had never been diagnosed. And that actually exacerbated some of the behavioral health issues because they were not receiving the appropriate therapy. Those 2 employees stepped forward and actually have helped us create a program, which we now have funding from the state legislature as of July 1 of this year, to begin to expand that program across Woodbury and Bridgeton to be able to provide these much needed services to our community. I'm very proud to tell you about our life expansion. We opened our new Life Center in Williamstown, and this program is offered as a national program. We've already offered one in Vineland for the last 10 years. And this is nationally known as a PACE program. And what it does is it provides the opportunity for the elderly to remain in their homes and provide whatever supported services that are needed. For some individuals, that may be a full day program. For others, it just means people are checking in them. For others, it just means clinic services or slight rehab services. But what it does is it makes people who otherwise would be eligible for nursing homes and qualify for Medicaid and are on Medicare to be able to access those programs, and most importantly, to be able to stay in their home. And I'm very excited about the opportunity to enter this new program in Williamstown, and really grateful for the partnerships between both Cumberland and Gloucester counties Medicaid programs in assisting us with this work. And lastly, just to show you that we have hired 37 new providers in 2022, and that we are anticipating adding 60 new providers in 2023 so far. Our team is just doing a wonderful job, and we are very excited about that. I spoke briefly about the behavioral health unit in Woodbury. We are, as part of our transition from Woodbury to Mullica Hill Hospital, we are rebuilding our emergency department as well as that behavioral health unit, and we also will consolidate our EMS station on that same property. One of our new programs, in addition, is our community health worker program. This actually began with a grant from Horizon, the insurer, a pilot program which was funded and titled Neighbors in Health. We began with a healthcare worker at Millville. This is somebody who provides the necessary connections for individuals to be able to connect to programs that they may otherwise be eligible for, or address those social determinant of health needs that may come up, either they be housing or food, or making sure that we get their children into daycare, or most importantly, connecting them to the community services that may be available to them and them not being able to be aware of. We have recently expanded this program through the generosity of a donor to be expanded in both Cumberland and Gloucester County, and we are very much excited about all that comes from this. These workers can not only do the things I talked about, but they also will arrange medical appointments, create transportation, and also, as I've talked about already, really help people meet those health goals that they may have. Whether it be life coaches or different opportunities to take advantage of the education programs that we have in our communities. Rowan College of South Jersey provides a wonderful opportunity, and there are tremendous grants and tuition reductions that can happen in order to make sure that we can connect those people. But as I've said before, if there was one theme, it's about the need to improve the mental and behavioral health programs in our communities. Whether they manifest themselves in violence or in child mental health issues, or just the need to make sure that we go back to what we started with as we talked about that maternal mortality, really addressing the opioid crisis. So I want you to know that we have begun our work in partnership, and I'd like to commend all of the local police officers and police departments who are working with us, but a special shout out to the prosecutors in both Gloucester and especially in Cumberland County. They have extended themselves and really developed these partnerships with us, especially Prosecutor Jennifer Webb McCrae. We've worked with her department to be able to identify federal opportunities and state opportunities to bring dollars to our community and find ways to work better. We now are the only new health system in the state to receive funding for an initiative which is called the New Jersey Hospital-Based Violence Intervention Program. We have partnered with Life Worth Living, Ascenda, the Interrupt Violence Group, and local public health departments, as well as county victim support programs, to identify firsthand when people are coming in under traumatic issues in the facility, and then be able to connect them to those immediate supports to be able to get them the care they need. We know that we also are creating the opportunities to support those families who find themselves either supporting people who have been victims of gun violence, or who they themselves have suffered from gun violence. Making sure that we identify and say right up front that those individuals are going to need more support, and be able to facilitate the therapies and the community efforts that are there to really make sure that we reduce the incidence of victimization, and really, most importantly, that we work to save lives. We also have an opportunity and have been working with the Millville Police Department, where we've been embedded with our police department in trying to find ways to reduce the incidence of mental health escalation and get those people who do have situations that they end up in a police situation, those behavioral health services immediately without having to go to that emergency department. We know that effective mental health and behavioral health emergency diversion program is successful and has a tremendous opportunity to be a critical resource to be expanded throughout the counties that we are in. And we want to thank again the Millville Police Department for stepping up and for volunteering to partner with us on that. As we look at the impact that we have had across all 3 counties, Cumberland, Salem, and Gloucester, you can see these are the investments that we've made. We've made a $76 million investment in 20, $86 million in 21, and $107 million in 22. We're very proud to support both the community programs that we support in our communities, as well as provide the charity care and the subsidization of critical services as we indeed move forward. Now, our overall statistics for the entire system. We have had over 28,000 admissions, 3,000 births, 173,000 emergency room visits. We have 1,200 members of our medical staff and 7,000 employees, 641 staffed beds and 671 licensed beds. And I'm also tremendously grateful for the 294 volunteers who come in and support us in each of our hospitals and many of our programs every single day. Now, as I put this slide up, you may originally be worried about that. Nobody likes to see parentheses in that slide. But I want you to know that we need to look at these things in a larger context and to be able to show that our future is very bright. We are looking at making those investments that our community needs, and our board and our community supports that. We want you to know that we've made significant investments in our employees by increasing the salaries. We know that everybody needs that to be able to have a competitive wage. And as we looked at our wages, as we sat through and looked at the marketplace, there were people that absolutely were paying more than we did, and we needed to make sure we made adjustments. As you saw, we hired 37 new providers last year, and we're going to hire 60 this year. We are looking, and we know that when you bring new providers on, it takes a ramp-up period. It takes time to be able to get those patients in the door. And so I do want to let you know and make sure you know that we have also received affirmative bond ratings from both Fitch and Moody's that at the very strongest level. In this economic climate, we consider this both an achievement and a testament to the incredible teamwork and dedication of our employees. We also received a 4% revenue increase in 2022 from our payers, but we know that that was not enough to outpace the spending on supplies and the investments that we needed to make to do so. But I want you to know that all of these investments were made with our community at the center of all we do, ensuring that we identify the needs and then find long-term strategies to be able to support those needs to then obviously continue to be that trusted resource and most important asset that we have in our communities. We are confident once we are through COVID and over COVID, and we receive the dollars that we know that we're entitled to from the federal government and the state for the COVID expenses, that we will see ourselves back on the right path. I will now take a breath for the first time in 30 minutes and ask if there are any questions first from those individuals at home.
No questions yet on Zoom, Amy.
Are there any questions from the audience for me today? I want to affirm to you that our commitment to these communities is through and through. We are so very grateful for our tremendous stakeholders and all the partners who have stepped forward this year to support us, our donors, our board of directors, and most importantly, the nonprofit agencies and the government agencies. None of the issues that we've talked about today will be solved alone. It will take all of us moving together on the same path, with the same focus, with the same commitment. And that commitment is our patients and our community. I'll do one more check to see if there's any questions that are coming online. I'm told there are not. I want to thank you for the tremendous opportunity and honor to serve the patients of our community, to serve our communities, and most importantly, to thank you all for your partnership. Have a very wonderful day.